Hello everyone. You're watching sqadia.com and I am Dr. Hamad Haider, and today our topic is related to the metabolic bone disorders. If a patient comes to you with a history of a fall or a trauma, it's very easy to judge definitely this is a traumatic bone injury. But sometimes the changes and the symptoms are so subtle that you have to dig out the detailed history and you have to go a detailed examination to rule out some of the metabolic causes which actually are systemic causes which affect the bone. In this topic lecture, we'll be going through first how to assess a metabolic disorders, what are the different metabolic disorders, their signs and symptoms, and how to take a patient's history when they present with subtle bone pains and aches and all these things. Then examination, and what are the biochemical tests and other investigations which point out to certain specific metabolic disorders such as osteoporosis, chronic kidney and mineral bone disorders, rickets, and Paget's disease. Then in the second section, we'll be going through the osteoporosis. We'll be briefly discussing its etiology and its risk factors. Postmenopausal osteoporosis we'll be specifically focusing on because usually it's very common in elder females, especially 50s and 60s years of age, and they have tendency because of decrease in estrogen and progesterone in their body. They usually tend to have increased traumatic injuries due to trivial falls. Patient may be coming to you with a history of just had a small fall or she resulting in a distal radius fracture. But actual problem was something else. Actually, there was an osteoporosis going on. The bones have become weak. As a result, even to a trivial trip and fall, this has resulted in a fracture. In the third section, we'll be going through the chronic kidney disease that is called as renal osteodystrophy. And if in adults, if the patients who are suffering due to long-standing diabetes and long-standing kidney diseases, as the diabetes also affects the kidneys, eventually there's a renal osteodystrophy in these patients. And we will be briefly discussing the pathology, clinical picture, and X-rays and treatment of those patients. Lastly, we're going through the rickets and osteomalacia. Rickets is basically a nutritional deficiency of vitamin D in children, and if the bone softening occurs in adults due to vitamin D deficiency, is termed as osteomalacia. And we will also be going through one of the rare disorders, but a very pertinent one as well, that is the Paget's disease, which is actually an abnormal bone remodeling disease. This is important because there's not only bowing and problematic abnormal bone remodeling, but there is always a chance of 1% of these Paget's disease patient may develop osteosarcoma, or called as Paget's sarcoma, which is a very severe important malignancy of the bone. Thank you very much. Keep watching sqadia.com.